Right. Yeah. I was saying I wanted to get I wish I had taped the conversation we had before about I guess your take on healthcare and I guess kind of some instances that happen that you know about. I think you were referring to because a lot of people they fear, you know, government kind of taking over healthcare. They think that, you know, there's going to be what the term that they use, like death panels, where they'll decide because we don't have money and because so and so is either old or they've had this problem for so long, or because they have something that's rare, we don't want to pay for it, and thus they're not going to get the service or surgery or whatever help they need medically. They're not going to be able to get it. And you were telling me about one instance about the insurance company and a patient being basically released before it was time for it was really before they were actually cured. It just happened to be an issue where the insurance company kind of dominated the show. It wasn't a doctor or hospital call.
Yeah, what happened, and I cannot remember who actually the patient was, but what happens is, say like Medicare. I think Medicare has a certain amount of days they'll cover. Now let's say, for example, and I'm not sure what it actually is, we have to actually find out how many hospital days will Medicare cover, but they'll cover a certain amount of days, and then the patient, it's like anything after that, they're not going to cover. The patient have to be discharged and go home. Now, they're not telling the hospital because they can't. They'll have a lawsuit. They're not telling the hospital you need to let that patient go home. What happens if the patient is not well enough to and ready to be discharged medically because of the doctor, then the hospital has to eat the rest of the cost, because sometimes they may have to do an appeals process, and I'm not sure how that works, but I'm not sure how it works, and it may be dealing with certain diagnosis or certain whatever wrong with the patient, but they're saying they only cover certain days. Now, that doesn't have anything to do with what's wrong with the patient. It's that this is their rule. We cover a certain amount of days. And then there has to be a break in the stay, and if the patient comes back, then they will, pay that certain amount of days again. But it's like they want a break in the stay, not just a complete stay. Well, and I can't think of who it was or even who said it, but there was a case where the patient was not ready. The doctor was not ready to let the patient go home. But the patient, they went on at the hospital. They were well enough, feel like they could walk, and they well enough to go on, but just go out, discharge, and then you can come back. And that's like a break in the stay. They have a discharge date where they discharge the patient, and then they have where they readmitted the patient back in, and say on the next day. But medically, the patient wasn't ready. They had to turn around and come back to there because they wasn't ready to go home in the beginning.
Yeah.
But it's it's all. And things tend to happen because of people that have abused the system. So then what happens is you got the government or whatever insurance, they put rules in place to stop the crooks. Right. But you also are tying the hands of the doctors. Obviously, the hospitals can't function without finances. They pay the workers, they got to have the money. But now what you've done, the government, because they're saying they're trying to stop the crooks, Now what you're saying is, okay, now we got to try to figure out how to keep the income coming in, because we got to pay the staff, we got to pay the doctor, we got to pay everybody that's involved here. And and so it just tends to be they're afraid that right now, even what's going on, with the government taking over more into this aspect, and then you got all of this stuff going on where, what is that guy named? Where if people, they feel like people aren't, going to improve, it's like, they're crying out to Terry Shiver, or whatever that woman's name was.
Terry Shiver out of Florida, yeah.
And so, it's like, I was listening to an attorney was talking about her one time, and he was saying that a lot of times, people, his son, and I can't remember what his name was, and it was a lot of times people didn't know that his son was an attorney because, of course, they got the same last name, and they both was awesome attorneys. But he was saying that the attorney for Terry Shiver was his son, and saying some people thought it was him, but because they didn't know Junior was there. Right. But and so he was saying that a lot of times people didn't understand exactly things that the public felt like, people that was go ahead on and I guess let her stop at this, didn't really understand the certain things that was going on. Terry was, and they were saying that she was, I think what that man says, like she was alert, she wasn't getting no better. But she was, I think that's what he said. She was labeled something like that. But I remember them, I talked to a doctor twice with the same thing about Pawpaw, that they wanted to go ahead and more or less put him on hospice, and what they do it, and they pulled back from the basically his care. Right. And because he wasn't going to get any better, is what he said. And I told the doctor, say no. I want y'all to do as all you can, as much as you can, as long as you can. And he walked out the room. And they talked to Nana again. Well, Nana came to me twice because they had said that, no, you do what you can. I'm like, and that's why, I wish Papa would have kept trying, because I was there a couple of times when he would get angry when he was much better. When he would get angry when the nurse came to help him to try to walk, to teach him to walk with the prosthesis for his exercise and stuff. Right. He truly didn't want to do it. Well, what happens is they document your records that the patient refused to do what he's supposed to be doing. So they're not having much success with him. And after you don't utilize your limbs and stuff for a while, then you're going to be where you can't. And you're going to get worse. And so, I wish he had continued to try, because basically they had just wrote him off. And when the doctor talked to me, one of the doctors talked to me, he talked to me about everything that had been done and that they had been paid for, everything that had been paid for to help Daddy. And Daddy, in the most cases, didn't want to help himself. And that he's not going to recover, and basically you've done all you want, and then, and basically his words was, go ahead on and let him go. And that's why, I was thinking about when Renee was saying that it's an exercise, sizes she don't like to do exercise. And I'm saying the worst thing you can do is to not to help yourself in this society. I mean, that's the worst thing you can do, is to not to be as independent as you can in this society, because they got a legal way to let you go. And if you're ready to die, they got a legal way to do it now. So, but like I say, that it all started with somebody being able to beat the system, the government trying to put stuff in place to put a stop back to it. But it also ties the hands of the medical field. And so it's just,
So what are the what are the? I remember asking you last time what you thought about adding, I think 30, 40, 50 million more people to the roles of healthcare, and you said you thought it was good, but that you had one concern. And do you remember what that was?
Okay, say the question again to me. You asked me about adding
30 million more
people.
Yeah, 30 million more people to the roles of healthcare, and you said you thought it was good that everybody would have healthcare, but you had one concern about that. And do you remember what that was?
I don't remember what I actually said, but how would it be paid for?
That's what you said. That's exactly what you said.
Okay, because I'm like, that's what comes to my mind right now, is how is it going to be paid for? You know, and right now, enough come out of my pocket. I mean, I'm trying to basically keep my head above water now, and with my own health care coverage and all of my regular basic needs, and I got home repairs now that's out of the wazoo. I need that extra money. I don't need it going in extra places, but it is good for people to not have to worry about health care. But I don't really know the answer is to keep overtaxing the people that's already, out there in this workforce. That's not an answer to me.
Right.
Because I know I need my money, and I need it in areas that I don't have right now. Things that needs to be done that I can't do because I don't have the extra money to do it. You got to limit people right now looking for jobs. Okay, so if I get out of the workforce and try to find a second job in order to be able to meet the demands, okay, the people that don't have a first job, what? So it's still going to affect somebody somewhere, somehow.
Right. So
I don't know what the solution is to that. I mean, I don't know. So some people, we're going to have to get healthy, sound like it, and don't need the medical.
Yeah.
The only thing I can see is just try to not to need it, because if everybody need it, then obviously it's not going to work.